At this point, we're ready to move into session one. It's my great pleasure to introduce Dr. Heather Modlin, who has worked with young people in residential care for over 30 years. She's currently CEO with Amal Youth and Family Center, a nonprofit organization providing a range of innovative, culturally diverse services to individuals, families, and communities. Heather previously served as the provincial director of Key Assets Newfoundland and Labrador, an organization that provides alternate and family-based care to children and youth. Dr. Modlin has served on numerous national and international boards and is currently chair of the Board of Governors of the International Child and Youth Care Network, an advisory board member for Snorwell, a company dedicated to the development of artificial intelligence-based products designed to support families in fostering healthy habits. Also, a steering committee member of the Global Social Service Workforce Alliance and an editorial board member of Relational Child and Youth Care Practice Journal. I'm very pleased to bring you Heather Modlin. Heather?
Great. Thank you, Kathy. I am very pleased to be here and to be able to have this conversation with you about the impact of the pandemic on the social service workforce. I'm just going to bring up my slides here now. All right, so I'm going to talk a bit about the challenges and the opportunities that have emerged from the pandemic with regard to the social service workforce. And I'm going to build a little bit on some of the information that Hugh has already provided. And as Hugh just identified, when we're talking about the social service workforce, we're talking about a wide range of professionals and paraprofessionals. So some of them being social workers, social pedagogues, child and youth care workers, community development workers, and then a whole range of other governmental, non-governmental professionals who work with individuals, families, and communities. And that includes those in management and academic worlds, etc. So when we look at the risks and the challenges for the social service workforce, Hugh has already gone through many of them. I think it's worth pointing out that when much of the world started working from home, the social service workforce went into work en masse. And not unlike what we tend to do in normal circumstances, we move towards the danger instead of moving away from it. And particularly in the early days, when there was all kinds of new information emerging about the pandemic and how to keep ourselves safe, there was a lot of anxiety and real risk associated with being out in the workforce, and particularly in the kinds of environments that may include congregate care or other things where people were being exposed to large numbers of people without really knowing what they were being exposed to. The second item there talks about there being no outlet. And I think it's important to note that the jobs that we do in the social service workforce, in whatever role we play, can tend to be quite stressful at the best of times. And it's very important for professionals to be able to engage in activities that can help them to de-stress outside of the work environment. And what happened for many practitioners, particularly during the pandemic, is that they got trapped in a go to work, go home, and go to work scenario. And without the ability to engage in the kinds of other activities they may have normally used as outlets for stress reduction, it really became quite a damaging cycle of going to work, going home, and going back to work. And that lack of social support and other positive activities that they may have normally engaged in really had an impact on many people in terms of their ability to cope. There were many situations where essential workers who were reporting to work lost a lot of the support staff. And so this happened quite regularly in residential treatment environments, in children's homes, and other kinds of substitute care shelters. And it was not uncommon for teachers and therapists and administrators and other staff working in a facility to start working from home and working virtual. But the frontline staff, who usually, depending on the country, would have been child and youth care workers or social pedagogues or social workers, still had to report to work. And not just had to report to work with the risks that we've already identified, but there were increased cleaning protocols. There was a lot of extra demand on their time. They often had to work overtime because people were either off sick with COVID or off with symptoms or waiting to be tested, and so there was a considerable amount of increased strain on frontline practitioners without the kinds of supports that they normally would have in the work environment from other colleagues. There are many stories I've heard of child and youth care workers, particularly getting locked down with the young people that they were supporting. And I was talking to colleagues from South Africa a couple of weeks ago who talked about children's homes where the child and youth care workers were 5 or 6 weeks in lockdown with the young people. And so obviously there are considerable impacts to themselves, their own personal lives, their own family lives, that were impactful. The social service workforce, by nature of the work that we do in supporting young people and families and communities, we're in a position where we were having to simultaneously deal with the challenges of the clients that we were working with, but also experiencing the same trauma ourselves. And so that put the workforce in a very unique position to be concurrently dealing with the same things that they were helping support other people to do. And then in the child welfare system, which already is overburdened at the best of times, the increased strain on the child welfare system, in part related to the increased isolation that families experienced, the lack of supports that they were receiving, increased even further the pressure on workers to support those families and to try to do that in different and new ways because the traditional ways of engaging families in many cases were lost or not accessible at that time. And then the increased workload and work demands, as I've already identified, and there are many things that contributed to that, but that all took a toll on the workforce. But it hasn't been all bad. And Hugh identified many positive adaptations that have emerged or are emerging out of the pandemic. And I'm just going to go through a few of those in a little more detail. There was an opportunity for shared experience. So one of the interesting things that we've heard from people working through the pandemic is that in some ways it created a level playing field. And so the workforce and the clients were going through a shared experience together. And that created opportunities for some innovative, purposeful use of activity in order to engage young people, particularly in substitute care, in ways that had maybe not been possible before with all of the external distractions that came from going to school and being in the community. And I've heard many stories of ways in which frontline practitioners were able to engage young people creatively and create new kinds of relationships that have emerged out of the pandemic. An interesting side note, I've heard from many people in many countries that a significant percentage of young people in care actually did better during the pandemic than number one, they thought they would, and number two, than they had been doing previously. And there's lots of speculation as to why that may have occurred. But in part, I think it relates to the shared experience. And it also relates to the increased consistency in staffing in some cases. So while one of the challenges was that many practitioners got locked down with the young people, or voluntarily changed schedules so that they worked worked a week or two or three or four instead of a 12-hour shift in order to increase consistency, but also decrease risk and the number of people coming and going. And that increased consistency seems to also have led to some interesting and unexpected outcomes for young people. And there are lots of stories of creative ways in which clients have been engaged. Again, in talking to my colleagues in South Africa who are connected with the Azbindi program, they have lots of stories of child and youth care workers dropping off food packages to families, doing doorstep visits, creatively finding ways to engage young people and families in outdoor activities where social distancing can be maintained, but they could still have some connection outside of the virtual world. And as Hugh identified, there has been an increased focus on wellness strategies for social service workers and for the workers. And that includes many of the things that Hugh identified, but things like increased resources, recognition of the need for increased training. Ironically, there have been opportunities for increased connection globally through the use of virtual world and at conferences like this, for example, that weren't happening with near the frequency that they do now. And so while we certainly lost some opportunities for in-person connection, we seem to have gained significant opportunities for virtual connection, ways that we could have done it before, we really didn't because the need hadn't propelled us in that direction. There have also been increased opportunities for virtual connection in different ways in terms of therapy sessions and engaging families in activities and team building among colleagues and other kinds of things that have emerged as perhaps one of the biggest adaptations out of COVID. And then, as you identified, increased recognition of the essential role of the social service workers. So what we're going to do now is move you into small groups. And before Kathy gives you the instructions on that, I just want to identify that there are 3 discussion questions that we would like for you to review while you're in your discussion. And the first one is, what are the biggest risks and challenges that you have experienced in your work during the pandemic? And how have you and your organization dealt with these challenges and adapted your practice? And then what opportunities for innovative practice has emerged? So this is really an opportunity for you to share your experiences and for us to learn from each other things that have been done across the globe in various organizations. Thank you.
Thanks, Heather. You've given us a lot to talk about in the breakout. And for participants, once you're in your rooms, please remember to unmute yourself, turn on your camera, and briefly introduce yourself. Don't forget to add some key reflections towards the end as you're wrapping up your discussion. And keep in mind, the questions are also on the Slido discussion thread, as well as in your participant pack. So at this point, we'll move off to the breakout rooms. Okay, welcome back, everyone. So Heather, in your travels around the breakout rooms, what did you pick up on?
Yeah, thank you, Kathy. It was really interesting. I think I made it to almost all the breakout rooms for a few minutes anyway, and there was some really engaging and interesting discussion happening. I think one of the themes that emerged in most of the conversations that I heard was around the theme of resilience. And there were lots of examples of people talking about the creative and innovative adaptations that they had made to get through the pandemic, and some of the things that are still being used now because they turned out to be useful. in a regular context. But one of the discussions I overheard was someone talking about having to go to work, and even though half your colleagues were off with COVID, but the demands didn't decrease, and the need to serve the young people and families and community remained the same and increased in many cases, and yet people were still having to meet those needs. And so those that weren't sick were left to work overtime to do the extra, and the amount of stress and strain that caused. But even in the midst of that conversation is that it got done. And I think that showed up in all of the conversations, that people stepped up and stood up and got the job done, and are still getting the job done, even in the midst of some really extreme circumstances. So yeah, so that would be the biggest theme that I would identify. There was an interesting comment made in one group that I took note of. Someone was talking about the biggest challenge that they had personally in working in the pandemic was having to wear a mask and shield to work every day. And we didn't specifically identify that previously, and it is a concrete example, but it's certainly one that has been the lived experience for many practitioners during the pandemic, and it certainly changed the nature of engagement with clients, in addition to just being very cumbersome for extended periods of time.
Yeah.
So
what it in my experience with the breakout rooms, I was hearing the theme for me was resilience among the social service workforce. That, when the chips were down, many of the social service workforce members were the ones getting creative to figure out how to move forward. Were you getting that in some of your tour?
yes, absolutely. There was actually a very good example was being relayed in one of the groups I was in for a few minutes from Kenya. And I think Astrid was the person who was talking about it. If you could put that in Slido, I think it would be really fascinating for everyone to hear about some of the work you were doing. She was talking about a coaching mentoring clinic that they had established. And it sounded like they had done some really, really innovative work there in supporting the workforce and clients. But those kinds of examples were showing up as I was making my way around all of the rooms.
Yeah. I was starting to also hear about the intersectionality of, the pandemic essentially showing us that there are some populations that are much more adversely affected when health care needs are high and they're facing other issues in their lives. It really shone a great light on all of those issues. Did you pick up on some of that as well?
Yeah, and some of that is showing up in Slido now as well. I think that really there are very clear differences within countries and within different groups around how people experience the pandemic and the types of challenges that they encountered. And then there are certainly some countries that experienced unique challenges in terms of their specific situation. But I'm just read a comment on Slido that came in about find it. In South Africa, challenges with students and community members not having equal access to internet or devices. So the digital divide was highlighted, and that divide, not just the digital divide, but divide in other areas also is showing up in terms of the intersectionality and the other things that have been highlighted by COVID.
Definitely something to put on a priority list for connectivity so that that divide somehow goes away. At this point, we've reached time, but let me just compliment you, Heather, and all the participants in discussion group on great sharing. We're getting a lot of good information here, and we want to keep the conversation going.